Hi, I'm Michael Joyce, and I'm the student pharmacist here.
Oh,
May I ask you or who you are?
my name is Yvonne Gong.
Nice to meet you, Yvonne. And how can I help you today?
I was wondering if you guys have something for weight loss. I'm trying to lose weight and I need something for my diet and exercise.
Perfect. I can definitely talk with you about weight loss medication. Would you mind if I would just take 10 minutes of your time
No,
and I would counsel you about that?
no, I don't mind.
Okay, perfect. So, uh, when did uh, when did your obesity problem start?
Way back in college, when I started college, I just gained weight.
Okay, and so did you have any issues before that?
No, I have never had weight problem before that.
Okay, and so why do you want to lose weight?
Because I don't feel good about myself. I feel very, very horrible about myself.
And so, where does this extra body fat accumulate?
In my stomach and in my thighs.
Okay, that's pretty normal. So, do you do anything that makes you feel better, makes you feel worse about yourself?
The thing that makes me feel worse is that I treat myself every week with ice cream, and I go out with my friends and we have this lattes. We eat this lattes thing, and when I come back home, I feel really, really worse. And the thing that makes me feel better is that I exercise. When I exercise, I feel really, really better.
I feel you. Those snacks. I mean, they're not the healthiest,
Right.
but we like to treat ourselves.
Right.
So, are you taking any medications right now?
No medications.
Okay. Do you have any allergies?
I'm only allergic to ragweed and pollen.
Okay, those are pretty common. So, those won't interfere with any medications. Now, are you on, or do you have any chronic conditions like diabetes or any health issues, anything like that?
No, I don't have anything like that.
Now, do you happen to know your BMI? I know this is a sensitive thing, but I need to sort of guess where to start.
The last time I went to my doctor, I think it was 32.3.
Okay, 32.3. That's pretty high, but luckily we can do something about that. We can help you. So, when you're at the doctor's, did they ever tell you, or did they ever check and tell you what your cholesterol was, or check and tell you what your blood pressure was?
They told me that my blood pressure was okay and that my cholesterol was okay.
Okay, perfect. Now, are you pregnant? Are you breastfeeding, or do you think you might be pregnant?
None of those.
Okay. Now, and do you binge eat and then purge or vomit, or do you stress eat, anything like that?
No.
Okay, good. And lastly, may I ask how old you are?
I'm 23.
Perfect. So it sounds like you're a perfect candidate for orlistat. It's also known as Ally or Ally, and it's a medication that will help you lose weight by preventing the absorption of fat in your stomach.
Okay.
So with orlistat, you're going to be taking one pill or 160 milligram pill 3 times a day.
Okay.
You can take this before you eat, or when you eat. But all you have to remember is be consistent with it.
Okay.
So every time you have a meal, maybe keep some sort of alarm or reminder to take your orlistat.
Okay.
So the most common side effects with this medication are oily spotting in the underpants, loose and frequent stools, a sudden urge to go to the bathroom, gas with some stool discharge, and a bowel movement that you can't stop from coming out, and that's just from excess fat in your feces because you're not absorbing. People have often also said they feel tired, weak, they might have some back pain, changes in menstruation, headache, and then stomach pain. But if you have any itching, any yellow eyes or yellow skin, any dark urine, or you just lose your appetite completely for a day or two, or longer, please see your doctor because although very rare, issues with or liver issues have been reported. So we just want to make sure. I notice you're not taking any medications. If you ever plan on taking multivitamins in the future, be sure to take them 2 hours after you take your medication. This way that it doesn't interfere with the medication in your stomach.
Okay.
Alternatively, you could just take the multivitamin at bedtime because I'm sure that you're not going to be having a large meal before then.
Okay.
Now, there are drug-drug interactions, but luckily you're not on either of the medications. It'll interfere with warfarin or Coumadin and cyclosporins. If you're ever prescribed those for whatever reason by a doctor, be sure to tell them that you're taking this medication.
Okay.
Now, if you're ever diagnosed with malabsorption disorders
Mhm.
or any one of the malabsorption disorders, be sure to stop taking this medication. And also, if you're ever diagnosed with a thyroid cholelithiasis, nephrolithiasis, or pancreatitis, be sure to talk with your doctor before you start taking this medication again. Now, with all those side effects, they do decrease the longer you take this medication. And they'll also decrease with the less fat you eat in your diet. So if you reduce the amount of fat you eat, the less you'll see those side effects. If you miss a dose, skip it and forget about it. Just move on to the next dose. So if you missed it, or if you're supposed to take it during lunch and you forget about it, don't worry about it.
Okay.
Just continue on your normal schedule.
Okay.
Make sure to store this in a dry place, away from people, pets, children. And for this drug, the best way to monitor yourself is to weigh yourself twice a week.
Okay.
And you just want to weigh yourself and then just record it. Because this drug you'll lose the most amount of weight in the first 6 months. But you will see some results within the first month. Now, this drug should be used in combination with diet and exercise, which you mentioned you already dieting and exercising. May I ask how many times you exercise per day? Or not per day, but per week?
Once or twice, sometimes twice, sometimes once.
Okay, you really want to start increasing that. Try to exercise. Well, start exercising every other day, and then increase that if your schedule permits. You want to try counting your calories and keep those calories below 1,500. If you have any advice on how to actually create a diet plan or exercise plan, you should see a physical trainer or a dietitian.
Okay.
Now, as I said, you will see weight loss within 1 month.
Okay.
You should come in 1 month from now after starting this medication, and we can discuss how everything's going, how your diet's going, how your exercise has been going, and see what we can do from there. You should lose a few pounds within the first month, and if you do, that's excellent. That's going to be a great start for the really rest of your treatment with us.
Okay.
So, do you have any other questions about this?
No.
All right. So, my turn to ask you some questions just to see what you took away from this. So, how many times a day are you going to take this?
3 times.
Okay. And when are you going to take this medication?
Before meal or after meal?
No, you just want to take it before the meal or during the meal.
Okay. Before or during the meal?
Yep.
Okay. 1 pill at a time?
Yep, 1 pill.
Okay.
And where would you store this?
In a moist place, away from my pets and my children.
Oh, no, in a dry place.
Oh, in a dry place. Okay.
It's okay.
In a
So
dry
that's
place?
why we're doing this now, in a dry place away from pets or people.
Okay.
And how often do you want to weigh yourself?
Twice a week?
Yep. And you want to use this drug in combination with
My diet.
diet and exercise.
Okay.
So,
All right.
it was nice to meet you, Yvonne.
Nice to meet you too.